Okay, let's talk about our patient today. Our patient today is a dentist. Young lady, a preeminent lecturer, a dental hygienist from Bulgaria, Buffalo, New York, Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers, 8 Lumineers, 10 Lumineers, 6 Lumineers, 10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient. And now we're not treating teeth anymore. We're treating smiles. Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. Our patient today is a dentist, a preeminent lecturer. You've probably heard him speak many times. He talks a lot about cosmetic dentistry and digitizing technology and how to upgrade your practice. And what's taking place right now is our 2-day live workshop where we actually place Lumineers on a patient. So many times people say, well, it's one thing to look at a video, but we like to see it live. So what's nice about it is Lumineers are not a replacement for traditional veneers. They're for all the patients who would have veneers if they didn't have to have their teeth cut down. And so if we keep things in perspective, the Lumineers, the Surrey porcelain have longevity. They solve many problems and help many patients where otherwise you wouldn't be able to help them. So now, where you save time in preparing the teeth, and the way we, quote, prep, prepare, modify, is that we work without anesthetic. I shave away anything that doesn't look good, and I shave away anything that looks like it might be an occlusal problem, an occlusal prematurity. So you start out with a knowledgeable assistant. So I'd like to introduce Lisa. Lisa's been with me for how many years?
32.
32. She came with me when she was, well, I won't even tell you, but she was very young. Really young. And the other thing she's done is she's prepared everything. At any rate, this is the key and the secret to success of here. To be able to do these procedures without anesthetic, I use 4 times magnification. And so I can't stress enough the importance of wearing 4 power, not 2.5 power magnification or more. Okay? You can't have too much magnification. Let's talk about the sapphire light. It's a whitening light. A study has just recently been shown that no matter what your chairside whitening agent is, that the sapphire light makes it work faster. It'll take less than a minute. Actually, it's going to take us 2 minutes to bond all of these in place once we start, because we're going to give them a 5-second curing exposure. The other thing that's important is taking a good impression. We recommend the Lumineers impression material. You'll hear more about that later. But if you have your foundation set and you got sharp margins, you'll get good Lumineers back. And then we're ready to start. She has the Lumineers, and the Lumineers are made of Surrey porcelain. It's not a Luminaire if it's not made out of Surrey porcelain. And Surrey porcelain, for all these years, has been able to be made as thin as a contact lens or as thick as you want it to be for contouring. So whether they're thick or thin is entirely up to you. By having these prepared, she's treated them with 2 solutions. And the solutions were the porcelain conditioner, and she's treated them with the Serenade Prime. The porcelain conditioner is very important because it's going to hydrolyze and activate the Serenade Prime. Why is that important? Because you want to activate your silane just before you use it. If we activate a silane and have it pre-activated, over time, those ends tend to polymerize with each other, and then they're not available for bonding to the porcelain. So you get a weaker silane when you don't activate it at the time you apply it. So you're going to get a chemical bond between the Ultra Bond Plus and the porcelain. So I'm going to take my micro etcher, right?
Correct.
And I'm going to close my eyes, and I'm going to put this on the left first bicuspid and the right first bicuspid. Don't breathe. Okay. And we'll come over here. So we're going to be doing surface preparation on natural teeth, and we're going to be doing surface preparation on porcelain. Once we've completed the surface preparation, regardless of what that surface is, then we'll start bonding to that surface. And we don't care what that surface is if we've completed the correct surface preparation. That makes sense? In other words, if you get the right surface preparation, then you can bond to it. Now we're going to put a cheek retractor in. Now what you want is a clean, dry surface. How long do you want that surface to be clean and dry? As long as it takes you to prepare and bond to it. I'm going to take and put paint on dental dam on the lingual side, open wide. And the reason I'm putting paint on dental dam is because I want to have blockage so the ultrabond won't get in the lingual interproximal embrasures. Now I'm going to take the light, and the best way to protect your eyes is to close them. So I'm going to stay about 1 inch from the surface. Close your eyes. And I'm going to polymerize that for a second or two. And I only want to partially polymerize it. Now let's see what we got here. This is really a nice way to prevent the ultrabond from getting in between the lingual side, and it facilitates cleaning up quite a bit. I'm going to put the Pourcel Lock on the porcelain. Now what is Pourcel Lock? Pourcel Lock is a hydrofluoric acid that's buffered. It's low concentration. And I put just a little bit on here. And I'll move it around with my brush. It's medium viscosity. Notice it's not running all over the patient's mouth. And so I'm preparing the surface of porcelain to accept a porcelain veneer. Something else I see here that concerns me a little bit is I got to get this blue out of here, because I think that our patient would be a little distressed. Give me that light again here, because that's kind of liquid. I don't want that to run under there and give you a blue lateral incisor. You may not be happy with me if I did that, would you? You'd be understanding. Close your eyes. Okay? And I just want to be sure that that doesn't run into the ultrabond. Okay, so now we wash off the hydrofluoric acid. Okay? And we don't want that to run all over. Now, you've heard a lot of terrible things about hydrofluoric acid, and they're all true. They're really bad. Hydrofluoric acid is bad stuff. So with the Pourcel Lock, it's a low concentration, it's buffered, and now we're going to put porcelain conditioner. So you have to have both of those on there. Now we took and put the porcelain conditioner on just like we're putting on now the phosphoric acid etch and seal. And I put etch and seal on because it contains aluminum oxalate, which seals the dental tubules. And so I'm doing the first step in conditioning in surface preparation. So the porcelain conditioner, the citric acid goes on the porcelain, and the phosphoric acid goes on the tooth. Now as I push this around, notice it doesn't run all over the mouth, just like we don't want the hydrofluoric acid to run all over. And what we are doing is just simply surface preparation. And see how that's nice and etched? That didn't take very long. And all we're doing is surface preparation. Serenade prime. Now we're going to try in a couple of shades here with the Ultrabond try-in paste. But before we do that, I'll show you what one looks like with no try-in paste on it. Stay open. And so we put that on, and that has air between the etched surface. And just put a little bit on these. We don't need so much on the try-in there. And we put the two together. Now look, they're the same shade. Now what's the difference? The difference is that between the left central and the tooth, there's air. Now, there's a thing called the medium, your contact angle. If you exceed the contact angle of the medium that the light travels through, and it exceeds a critical angle, it stops going forward. So when you have air and you have the porcelain and then the tooth, you exceed the critical angle. And when you do that, you get the reflection back from the etched porcelain, not from the tooth. So you can put it in the mouth, try it in, and if you aren't using the try-in paste, you'll get a different shade than you're going to get when you put it in. Now over here, we get the light transmission to go all the way to the tooth and come all the way back. We don't exceed the contact angle. So this, we're getting a view of what the tooth looks like with etched porcelain. You really can't take a shade on a porcelain veneer if it's thin, unless you've got something to back it up and show you what you're going to have. And this is what I normally do with patients, is I try in two of them and see which shade they like. Now if I put these all in, they look okay, and they look really pretty dramatic in his mouth. But when you're getting somebody on a try-in, they're looking for what's wrong. And I don't like to start out looking for what's wrong. So if we start out and we have them involved in selecting the shade, they're real happy with that, generally. Now you can see the difference. We have that left central has the supreme white. It's a new shade that's even whiter. It's just a little different. And then the right side is A1? A1. A1. And what Lisa's going to do is clean these up with Tenure S. And I'm going to apply Tenure S to the teeth to clean these up. Now what happens is you don't have to wash the Ultrabond Plus out, because Ultrabond Plus is the same resin as Ultrabond. The try-in paste is the same resin. So if she doesn't get all of the Ultrabond try-in paste out, the Tenure S will polymerize the try-in paste. Another benefit of applying Tenure S before you put the resin on is that what happens is it will coat the surface with resin. Now, you always want to be protecting the tooth against contamination. So what we accomplish by putting Tenure S on is we get resin to the surface. So the race between resin and contamination is always won by the Tenure S. Right central?
Right central. The right lateral.
Pardon?
Right lateral.
Right lateral. And what we're going to do is now switch over to the finishing off the left side. And you just gently put these into place.
Left lateral.
Left lateral.
Left cuspid.
Okay, Ultrabond is really an ADA type restorative. Now our objective is to do what? To get a stress-resistant, non-micro-leaking restoration. Now we're putting this over porcelain just like we did natural tooth structure. What was the difference? The only difference was surface preparation. And that's all there is to it. I'll get the brush and then I'll take the Scooby. Now the Ultrabond will set all by itself in about 10 to 15 minutes. But we like to cure it with the light. And you want to make sure that you have plenty of excess all over. One of the biggest dangers you have is if you get a void. And the void is just like getting a void in your impression if you get negative pressure there. So I want to see plenty of Ultrabond filling in those margins, because those margins don't look full when I put them on. And then when I put the tip on to spot cure, I want to see excess coming out of all the margins. Now we're going to take the 2 millimeter tip for 1 second, and I want to see Ultrabond coming out all over, and I do. Close your eyes. The best way to protect your eyes is to close them. Close your eyes. Close your eyes. And close your eyes. And pretty soon I'll put on 2 more Lumineers.
God, sir. You ready for the next one?
The right side. Okay. And if you notice, I stayed 1 tooth away on the spot curing. I didn't cure the right lateral. And this is porcelain on porcelain. But you know, it really doesn't know that it's porcelain when I'm putting it on there, because we did surface preparation. And by doing surface preparation ahead of time, you're able to have that surface accept whatever you put on there. That's why the rule of 55 is so important, and your clinicians are teaching you about that. Close your eyes. And close your eyes. Let me get this here. I'm going to make sure you got them settled just right. Close your eyes. And we'll do the last spot cure. Close your eyes. Okay. This really gets to be a simple procedure if you've done adequate preparation. And I take some of the bulk off there. And I'm wiping all of this off the lingual side. And then when I finish wiping it off, I always want to wipe from the gingival toward the incisal. Well, I think we got most of it there. Can you all see how little we have on the lingual side now? And now I'm going to do the final polymerization. So we'll start on the left side with the sapphire whitening light. Close your eyes. And we apply it for 5 seconds. And close your eyes. Close your eyes. So here we're taking and transforming a smile, getting the same result that we get if we ground the teeth down for porcelain veneers or if we ground them down for porcelain fused to metal crowns. Now we'll go in and show how to finish these, okay? All right. First thing I'm going to use is a 12-fluted burr high-speed water spray. Now the reason I'm choosing a burr is, as you can see, there's a lot of Ultrabond in those interproximals, right? And all of these instruments that I'm using or going to be using are in the finishing kit. Now I'm using 4-power magnification. And if you notice, what I'm doing is taking the material out of the interproximal. So what I'm doing at this time is I'm going over the interproximals and removing the Ultrabond. Now one of the things that we're going to do today is we're going to open the contacts. But we're not going to open the contacts where we've placed the porcelain veneer over porcelain. Okay. The other thing that will happen is you'll notice the Ultrabond will start coming off much easier once you start getting some water on that surface. So we covered a lot of ground in between getting down to opening these interproximals. Open wide now. And I'm just going on the lingual side. And I'm about 14 or 15 inches from the patient's tooth. But visually, I'm only about 2 or 3 inches. And the secret to opening these contacts is to get all of the Ultrabond out before you try to open them. Let's take a look now. And there you can see we've removed most of it, but there's still a lot in there. We don't want to open the contacts yet. But look how these interproximals look better now. Now they don't look anywhere as near as they're going to look after I start using the needle nose diamond to open those interproximals. And now we're going to take the needle nose diamond and go back the same way we did with the 12 fluted burr. And what I'm doing is removing the shoulder. Now think about it. We didn't put a shoulder in the tooth. So we created a shoulder in porcelain. We didn't retract tissue. There's a shoulder at that gingival margin. And so we're going to, at a 45-degree angle, remove that piece of the porcelain and blend it to the tooth. And what we'll do is get most of it done today. But what my normal process is, I have the patient back a week later, and I do about 90 to 80% of the finishing on the placement visit. Now you'll start seeing these interproximal embrasures opening up, and it's because of this diamond. Now let's take just a moment here, okay? But look at his left central and his right central. You see, as we begin to open the embrasures on the left central, it begins to take more of the shape that it should have. And so then we'll do this on the right central next. Okay? And this is when the teeth start coming to life. So when I try to do these on a try-in, and I haven't removed tooth structure, they just don't have the same look. They look better, especially if they're dramatic before and after in the change. But now, if you get shoulders, when patients have embrasures, spaces in between their teeth diastemas, I don't try to get all of those removed on the interproximals. I sort of pretend like they're a cantilever bridge. And then I start taking out more later. Okay, open. There we go. Now we're going on the lingual side with the needle nose diamond. And opening that embrasure a little bit more. Now I'll take the football-shaped diamond. And as I said before, all of these little instruments are in one kit called a finishing kit. I used to call them off, and somebody said, why can't you just put them all in a kit? And so we did call it Lumineers Finishing Kit. Now I'm going with direct vision, and I'm blending porcelain and Ultrabond all together. And on the porcelain crown, I'm blending porcelain and Ultrabond together. Okay, open wide. And then we'll check the occlusion here pretty quick. Okay. Now, open. Now close again. Look at how those incisal, just put your head down a little bit there, that's good. Now we can change those incisal edges as much as we want to after we've bonded them because they're being supported. Open. And let's take a look and see what we got. Well, the good news is, it doesn't always happen that way. Let's take an explorer here and see what we're looking at. So we get a little in here, natural tooth structure, natural tooth structure, and there's a little extra Ultrabond on here. Now what happens is that as much as I used to try, I'd keep the patient in the chair for 3 or 4 hours trying to get every last little bit of Ultrabond out. And I never did. What I found was that if I can get the patient out of the chair between an hour and an hour and a half, they're not fatigued yet, and they're so impressed with the appearance and the change in their appearance that I tell them they're going to have little things flaking off for a week or so, and they don't mind. Let's see what's going on back here now. But these teeth are now going to be strengthened against fracturing. That's the other benefit. By not taking anything away, we put the Lumineers on it. It's a splint. It strengthens the tooth. So here we go. Look at these natural teeth coming together. Didn't open the bite. Now we're going to try some lateral excursions and see what happens. And you want to do these gently because you've had a habit of doing them too hard. So just gently go sideways and forward and all over. We're getting some disclusion on the cuspid right here. Now this is what we want to look out for. See this right here? That area we want to take down a little bit because that could chip real easy. This incisal edge we may want to take a little bit off. And look at this corner right here. See that? These are areas waiting to break. So as much and as simple as the process is for what we've been doing, and here's his cuspid guidance here. So we're going to take a little bit off on those incisal edges. And what's nice is he's got a partner back in Chicago that can finish this off for me if I don't get it all today. And I rarely get it all today. So now we're going to open the contacts. And we're going to avoid the contacts next to what? The porcelain laminate on the porcelain surface, because we're going to put a little force in here, but not too much. Do you see how easy that is going through there? Why? Because I got rid of the Ultrabond first. Now, if I try to open the contact with the Ultrabond there, man, that's a lot of work. So, and then if you're sawing and it gets stuck, then you just start rocking like this. Now, this is called a Surrey Saw. So what you do is when you get halfway through and you feel resistance, stop sawing, start rocking. Now I can't go to the distal of the cuspid. Why? Because it's porcelain on this tooth. And what I want to do there is make sure I relieve the occlusion, leave it alone, and I tell the patients not to eat peanut butter or whatever they do that can cause things to break for at least 24 hours, and then I have them back. Well, what did we spend? We spent 20 minutes finishing maybe? I've opened all the contacts. Now we come back with the Surrey sander. I'm going to let you do the final polishing, Lisa. I guess that covers everything for today. You're in very good hands, all 3 locations, and hopefully you're in good hands too. All right, so there he is. But just look at that. Okay, hope you all have a great rest of your life practicing dentistry with Lumineers.
I chose to get Lumineers instead of traditional veneers because I didn't want my teeth prepped. They were fractured, short, at an angle, and small, and I avoided doing them. I had a bike accident which cracked the front ones. They were already worn, and I avoided doing veneers because I didn't want them prepped. So I sort of bonded, rebonded, let them be. After doing some Lumineers, I liked them enough, I said, okay, I'm going to go have them done. And that's why I did them. Well, I heard about Lumineers because I took Dr. Ibsen's course 20 some odd years ago when we were very young. And patients were asking, I saw the ads. I didn't like prepping teeth for veneers. I turned patients away who were young, saying I won't do your veneers until you're older. And now we've been calling them back into the practice, and we have gotten enormous acceptance because they already wanted them. I just was hesitant to do them. If I'd had to have the teeth prepared significantly, not just recontoured, I probably would have continued with bonding and repairing it. or just avoiding it. I may have intellectually said I'm going to do it, but I just had said that for so long and I never got around to it. This was easy. I had noticed just this afternoon, since they were done, that I did hesitate when I smiled a little. I don't think I wanted patients to see the bonding, some demarcations. So that became sort of a habit, because I noticed it recently when I was just smiling. I said, wait a minute, I don't have to just sort of like almost smile anymore.